my name is Morgan Stebbins. I'm a PN student at Wilson State College, and today I'll be showing you how to insert an NGT tube, how to be removing it, and how to administer medication through it. Now, before I can begin, I'll need to look at my provider's orders. So it looks like today my patient is 33-year-old female Shirley Cost. Her date of birth is 4/3/1987. She came in with a small bowel obstruction. Her diet is NPO. She's got a couple of labs. Her vital signs are routine. And then she's got an ultrasound of the abdomen, and then the insertion of the NGT tube for gastric decompression. Hurricane 1 spray before inserting the NGT tube. 2 x-rays of after the NGT tube, just make sure it's in the correct place. And then attach the NGT to low intermittent suction once placement is confirmed. And then strict INO, and then irrigate the NGT PRN as needed from Dr. Instant. So that is perfect. And for that is for 10 a.m. So currently it's about 9:45. So that's perfect. It's within policy. So I'm just going to go over to my MAR and make sure everything checks out. And then right now, okay, so it is 9:45, and then at 10 a.m. for the Benzo Hurricane 1 spray, 1 spray. So we've got, that's correct. So that's Shirley Cost. So Shirley Cost, perfect, and that's 4/3/1987. And then I do see she has allergy to penicillin and furosemide. So I'll just make sure that none of the medications today have any interactions with those, and they do not. So that is good. So I'm good to head in. So perfect. So I'm just gonna take this in. And for my spray, I would have done my 3 med checks and prepared all of it beforehand. But because of this demo, we'll just pretend that I've already done my 3 med checks for my spray and everything. So I'm gonna head in. Hi Shirley, how are you? Oh, you're not feeling the best? Okay. So can I just check your date of birth, please? So 4/3/1987, perfect. So I'm just gonna double check that. And then what's your name? Shirley Coast, perfect. Okay. And then I do see on you here you have an allergy. Yep, penicillin and furosemide. So just letting you know, none of your medications today will have any of those. Okay. And Shirley, do you know what's going to be performed today? You do. Okay. So I'm just gonna tilt your bed a little bit more up. Oh, I guess that's all we can get, so that will be good. So do you have any questions? No. Okay. So Shirley, can I ask, have you had any facial traumas, any broken noses, any nose bleeding, any abnormalities that you can think of? No? Okay, sounds good. So first, Shirley, I'm gonna perform my hand hygiene, and then I'm gonna put on my gloves so I just have them ready for my demo from the back. And then Shirley, we're gonna start off with this hurricane spray. I'm gonna give you 1 spray in your mouth. It's a numbing spray for your throat. Okay? Do you feel comfortable enough to do that today? Yep. Okay, sounds perfect. So Shirley, I'm just gonna give this ready, and then I'm gonna come over here and I'm gonna do 1 spray, okay? Can you open for me? 1, 2, 3. Shh. Okay, perfect, Shirley. Good job. So I document that, and then while we're waiting, it takes about 10 minutes for the spray to go into effect. So I'm gonna get my tube ready, and then I'm gonna listen to your bowel sounds. Okay, Shirley? Perfect. And then I'm gonna listen with my bell. And then Shirley, I'm sorry, I'm just gonna lift this up a little bit, okay? I'm gonna listen to all 4 quadrants. Okay, Shirley. So you do have some hypoactive bowel sounds or absent, which is normal. So I'm just letting you know. So now I would have changed gloves, and I would have grabbed this, and while we're still waiting, I'm just gonna measure. So I'm going from nose to ear, and then from ear to about xiphoid. So right down there. So right at this mark. So now I'm just gonna take this. There we go. So I have my tape mark, and that's perfect. So then I'm able, and then I would get everything ready. So Shirley, I'm just gonna put this on you, okay? This is just a towel or chucks. Perfect. There you go. And then here's your kidney basin if you need it. And then right here, here's your water, okay? And her left hand would be out, but for this demo, I'll just leave it as is, not to disturb Shirley. Okay, perfect, Shirley. So I'm also gonna just get your nose ready and clean your nose. So when I put the sticker on, you don't have any oils or anything like that, okay? Perfect. You still doing okay? Okay, so Shirley, before I begin, I'm just gonna let you know that I'll have some hand motions with you just because it'll be difficult to talk, okay? So if ever there's any point with your left hand, I'll have you go like this. And then if you're still doing good, give me a thumbs up, okay? But before we begin, I'll give you a tissue. And then I'm just gonna have you occlude one of your nostrils and like you're just breathing a deep breath. Or if you need to clean your nostrils, anything like that, we'll do that, okay? So ready? Occlude one and blow. Occlude one and blow. Okay, which one felt good? The right one? Okay, perfect. So let me just check with my pen. You have no obstructions or anything. Perfect. Okay, they look good. Do you need anything before we begin, Shirley? No, okay. So let me just get my tube out. And then I'm gonna just lube my tube 3 to 4 inches. And normally we would have actual lube we're using, but for this demo, we're gonna be using the spray because it's safer on the mannequins. So I'm gonna just make sure to get that. I'll put that there. Okay, perfect. And then I'm gonna open up my syringe and get this ready. There we go. Okay, perfect. So, Shirley, are you feeling okay? You are, okay? Oh, one side. There we go. Okay. There we go. And then Shirley, do you have any questions before we begin? No? Okay. So by now I would have changed my gloves, cleaned my hands. You've got your cold water. Do you need anything else? No? Okay, looks like we're good to go. So I've got my syringe here for gastric juices. And then I'm gonna get my thing ready and tape. And then I've got my pen light for everything. So here we go. Here's my sticker. Okay, Shirley. So I'm gonna have you extend your neck and then like you're looking back at the light, okay? Okay, perfect. So we're gonna do this on 3. So ready? And you said your right nostril, correct? Okay, perfect. So ready? 1, 2, 3. Perfect. And then I hear Shirley gag, so I'd pull back about 1/8 of an inch. And then I'd have her either do a couple deep breaths and relax. And then I'd tell her that to grab her cold water. And that when I say swallow, I'm going to further advance it down your throat, okay? Okay, perfect, Shirley. So ready? Swallow. And I'd be rotating if I need to. Swallow, 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 swallow. Okay, so I felt my resistance and that's close enough. And with these mannequins, it's hard to get it all the way where it would normally be from your measurement. So I'm gonna take my spot and I'm gonna grab my tape and then I'm gonna put it on my mannequin, tape this right away. If I needed help securing this while I grab, I'd ask Shirley to help, but we're good. And then I'd mark 2. Right there, perfect. Okay, Shirley, how are you doing? You're doing good. And then I would also bobby pin this, but since eventually I will be measuring this, I know mentally that I would just bobby pin this, but for demo purposes, since it'll be easier, I'll just leave this like this until I'm done measuring. So now I would draw back about 10 mils of gastric juices. Okay, and once I have that, then I close this. Perfect. How are you doing, Shirley? Good? Okay. And then I'd put this in here. Okay. And then I would dip it in with my litmus paper. And then from my litmus paper, it's going to turn. So it's about a 3. So that's perfect. That's within. So that means that we're probably in Shirley's stomach. But we can only be sure if we call radiology. So we're going to call radiology. So I've given radiology a phone. They've taken an x-ray. And then I would have came back in the room. I would have taken off my gloves, performed hand hygiene. Then I would came in, put on my gloves, performed hand hygiene. And then I'm just going to be verifying her date of birth again. Hi, Shirley. So what's your full name? Shirley Koss, 4/3 of 1987. Perfect. Okay. That's what it says here. Shirley Koss, 4/3, 1987. So, Shirley, while I'm here, I'm just going to I'll first assess your bowel sounds. Okay. And I forgot to mention, but after I would insert my tube, I would document this, and I would do all the correct documents. And so now that I've done that, now I'll be measuring, and now I'm able to put that bobby pin on. So, perfect. So Shirley, I'm just gonna be measuring your tube. I'd measure this in centimeters. Okay, perfect. So make sure that. And then we have about 55 centimeters. So perfect. I would make sure to write that down. And then I'm also going to take and bobby pin this onto Shirley. And we're doing this so throughout our procedure and throughout when she's hooked up to suction, there would be no chance of it being yanked or moving. And if there was, it wouldn't be that difficult because it would be attached to her. So perfect. So guess what, Shirley? Radiology called and they said that your placement is correct. So that's perfect. So now we are able to hook you up to suction. So I'm gonna come over. Sorry about that tape. Okay, perfect. So then we're gonna have the anti-reflux, and then we're going to have the valve. So I'm going to put that right here, and then we pretend our suction is over here. So hold it there. Shirley, are you doing okay? You are. Okay, thumbs up. Perfect. Do you need anything? Okay, I'm going to leave your call light right here, and if you need me, just come ask. I'll be here about 4 hours to come check back on you. Okay, sounds perfect. Thank you. So then I would clean out my workspace. I would document my intervention about the suction, and then it's been about 3.5 hours. I'd make sure to have my gloves off, do hand hygiene. So now I'm looking at my doctor's orders, and it's about 1,400, so that's perfect. So on their doctor's orders, it says diet advanced to clear liquids. Ativan 2 milligram tab per NGT PRN for anxiety. So I'm just going to confirm this is the right patient with my mom. So Shirley Koss, 4/3 of 1987. Shirley Coast 4/3/1987. So that is perfect. So I'm able to administer that because I've checked it, and it's about 1400, so about the correct time. So that's perfect. So I would come back in the room. Hi, it's me. It's your student nurse, Morgan. Nice to see you again, Shirley. Can you just have me, verify your name and date of birth? Okay, Shirley Coast 4/3/1987. Perfect. Just gonna double check that on your wristband. Perfect. So Shirley, I got an order for your Ativan. Do you know what that is? Yep, the doctor explained. Okay, so I put new gloves on, do my hand hygiene, and then I would have done my third med check in the room. But we'll just pretend this med is crushed up, okay? So I'm gonna just move this over, and then I'm just gonna check that her insertion point's the same, the tape's good, okay, and then I'm gonna remeasure. So I'm just gonna go like this, and then I would close this. There we go. Okay, and then I would unclip this if need be. So I'm just gonna unclip this. There we go. Perfect. And then I'm just gonna be measuring this. So 55 again, so that's perfect. And then I'm just gonna be checking for gastric contents again. So, how are you doing, Shirley? You're doing good? Okay, perfect. So I'm gonna draw back about 10 mils, perfect. I'm gonna close this, put it up here, and then I'll put it in my cup. Perfect, and then I test this. Okay, that's a 3, so perfect, we're still good. Shirley seems to be doing good. And then I would get my 30 or 60 mils of water ready because I'm gonna flush with 30 first, and then I'm gonna administer my medication, and then I'm gonna flush again afterwards. So I'm gonna grab my syringe, and I'm gonna draw up 30. Okay, and then before this, I would have this crimped before, and then when I administer the water, I'll uncrimp it, and then I'm gonna do this slowly to prevent any bloating or discomfort for the patient. And then as soon as the last drop, I'm gonna crimp this again. And then for this, I would have my medication with my water in, and then I'm just gonna take this out. And then I'm gonna pour my medication in. And I would actually pour it in like that. And then I pour it in, and then I would let it go, and then let gravity do its work. And so perfect, once the last bit of medication, I'd crimp this again. And then I'd obviously have like 2 syringes for this to make it easier on me. And then I'll just show you here. Here, I'm gonna close this so it's easier for me to pull my thermos. So we're closing that, putting that up there. Perfect. So we're gonna pull back 30 mils. The water to flush again. So this would be crimped. I just can't do 2 things at once, so it's not. Okay, and then once I administer, I'd uncrimp. I'd slowly push this down, and then I'd uncrimp this. And I'd make sure Shirley's doing okay. Are you doing okay, Shirley? Yep, okay. So, I would make sure she's doing okay. I'd come back in a little bit to assess her. I document the administration of the Ativan 2 milligram tab. And hopefully, Shirley, you'll feel less anxious because I know it's not great having that in your throat, okay? So then I would leave for a little bit, and then I would come back in. So I go, hi, Shirley, how are you doing? Feeling feeling a little bit better, a little bit more calm? Yeah? And I'd obviously have taken my gloves off and performed hand hygiene. And then when I re-entered, I would have put gloves on and performed hand hygiene. So I'm just going to be checking your bracelet. So Shirley Cost, 4-3 of 1987. Shirley Cost, 4-3 of 1987. And then on here, lastly, I have the physician's orders for removal of the NGT. Then their diet is advanced to stop. So I'm going to go Shirley Cost, 4-3 of 1987. Perfect. And okay, so that all matches up. So, and it's about 4:30 or 16:30. So that's good. And beforehand, I would have removed this because it's not that comfortable for Shirley. But for demo purposes and making it easier, I just left this on. So Shirley, you're doing okay? Okay. So do you know what we're going to be doing today? Yes, removing that? Okay. So I checked the insertion point. I would measure if I felt like that was necessary. So I'll just do it one more time. There we go. 55, perfect. Okay, and then I'm just gonna get everything ready. So I'm gonna get this ready. And then Shirley, do you have any questions for me? No, okay. So I'm just gonna take my adhesive remover, and then I'm just gonna get this ready. Perfect. And then I'm gonna get my gauze ready too. So I throw this away. Okay, Shirley. So I would have changed my gloves and everything. So when I have you take a deep breath, I'm gonna have you take a deep breath and hold it, okay? Okay, perfect. So I'm just gonna have this. And then this will be mainly removed, and I'll just put this on here. Oh, got stuck to my glove. There we go. And I take my gloves, and I'm just gonna have her remove this. And we're gonna take a nice deep breath. So I'll just put that there. Okay, so I'm gonna have you take a deep breath, and we're gonna hold this, okay? Ready? 1, 2, 3. So that would swiftly come out and all set on here, and I wouldn't touch it like this, but so it'll just stay up like that. And I would just wrap this up, and then I put this in any biohazard container or anything per policy orders. And then if Shirley needed it, I would make sure she had a washcloth or anything if she felt gross, or like that she needed to freshen up a bit, when she could have mouthwash. And then after that, Shirley, I'm just gonna take listen to your bowel sounds, okay? Okay, perfect. Okay. Here we go. Okay, thank you. So Shirley's bowel sounds much better, more active. Are you feeling a bit better, Shirley? You are. That sounds perfect. Do you need anything? No, you're good. You're going to watch TV? Okay, perfect. Are you comfortable in this position? Yes? And I would have taken off my gloves before this procedure, and I would have cleaned my hands. I would have cleaned out my workspace. I would have documented the procedure, and then I'm going to make sure Shirley's okay. You're okay? You're comfortable? And then I would reassess her in about 4 hours or even sooner if she need be. So, thank you.